Hi, my name is Ward Smalley, and I'm a prosthodontist and orthodontist from Seattle, Washington. I teach at the University of Washington Dental School in the departments of periodontics, prosthodontics, and orthodontics at the graduate level, and my emphasis on teaching is on interdisciplinary care. Today I'm going to talk about how to talk to patients that you think require orthognathic surgery to correct their problems. Many times, dentists that don't have a working knowledge of orthognathic surgery, don't really understand it too well, have difficulty presenting that to a patient. I see that on a daily basis with our residents and all in periodontics, prosthodontics, and even orthodontics, that when they advise the patient that they need orthognathic surgery, that their nonverbal movements express, the patient can actually read their nonverbal posture and stuff, and they're thinking that this guy doesn't really know if he really wants to recommend this, and they can't wait to get out the door. And then the residents come to me and they say, well, I talked to my patients about orthognathic surgery and they don't want anything to do with it. I say, well, yes, patients really don't want orthodontics or orthognathic surgery, but I've been practicing orthodontics for over 30 years, and a lot of those patients needed orthognathic surgery. I can only think of about 1 or 2 patients in the past that actually did not go ahead with orthognathic surgery. And they went ahead with it, the majority of those. So it's all in how you explain it. So when I explain that to a patient, or anything for that matter, whether they need orthodontics or orthognathic surgery, I'm going to express to them that that's what I would do for myself, my wife, or my kids, anybody close to me. I want them to get the impression that that is the best alternative for them. And when they can read that in my nonverbal posture, so to speak, and the words that I express to those, they go ahead with the treatment. And so I advise most dentists, particularly if they think orthognathic surgery is pretty radical, like maybe most of us, like in dental school, and when somebody talked about that, you're going to break your jaw, they probably think, well, who the heck is going to do that? I would advise you to have someone else that is a more expert in that area that can explain it to the patient so that the patient can understand, feel comfortable, and make the right decision in choosing that kind of care for them. So that's my expert tip for the day.